Hello, everybody. I will be sharing a short presentation on a topic I'm really passionate about, which is working as a hospice nurse. I've entitled my presentation, What Do You Know About Hospice? A short presentation from a hospice nurse's point of view. So, my name is Yvonne. I've been a nurse for about 7 years. I've worked as a medical assistant, nurse assistant, now LVN, and attempting to further my career as an RN. I feel like my job is very rewarding. Nursing as a whole is not for everybody. You will work with blood and respiratory secretions, and you will be thrown into scenarios that you feel like you don't know how to handle. There are times where you get sad and you want to cry and you feel defeated. Hospice, death is imminent. You are going to see dying patients, mourning families, grieving families. But I also feel that the same way life is celebrated and nurtured and cared for, we must be prepared to talk about death. Death is imminent. Everybody's going to die. So I feel like it's very important. I wanted to talk about this topic because it's often a huge area of discussion when I tell friends or people what I do for a living when I'm asked. And I often hear, their misconceptions that they have about hospice care and what it means to them. Um, we can talk forever just about, I often hear, how can you do that? Oh, I could never do what you do. I could never do that. And like I said, it's not for everybody, but it is a passion of mine. And I decided to talk about it because I feel like I really love my job and I do it well. In hospice, we deal with patients who have a prognosis of 6 months or less to live. Some of the illnesses that are cared for that our patients have would be dementia, Parkinson's, Alzheimer's, Lou Gehrig disease, cancers, all kinds, breast, esophageal, just every cancer you can imagine, cardiovascular disease, including stroke patients, AIDS, COPD, the list goes on and on. We hear a lot of, like I said, misconceptions about hospice. One of the ones is the negative connotation that the use of morphine and opioids have, the comparison amongst palliative care, the different kind of entities of care, palliative and hospice. We hear the misconception about, we often hear patients or their caregivers telling us, oh, when they go on hospice, they lose all their rights. They don't make the decision for themselves anymore. And that's farthest from the truth. What my job consists of, I had no idea before I became a nurse. I imagined going out to a home and patients literally dying in front of you and, everybody mourning and grieving and everybody scared and myself not knowing what to do. But that's not true. I come in, I do check vital signs. We manage Foley catheters. We start catheters, discontinue catheters, PEG tubes, G tubes, J tubes. We do ascites drainages in the home, wound care, medication reconciliation at every visit, which is making sure that all medications are available for the patient. We don't ever want a patient to run out of very important medications. And of course, we report all concerns, questions, and change of conditions to our physicians. A patient is followed by a whole interdisciplinary team, which consists of the CHHA, the RN case manager, the visiting nurse, the LVN, volunteers, the physicians, of course, social workers, chaplains, and we're available 24/7 to the patient. If there's a change at night, an emergency, they call us and a nurse will come out right away. We love to establish a rapport with our patient. It's very important. It's very necessary to learn about the patient. You'll be working with different cultures, different personalities, different religions, different scenarios, different demographics. You'll go into situations where, it's things that you've never seen before and you have to be ready and willing to handle them. And if you can't, call the appropriate people to facilitate the issue. But our main goal in hospice is pain and symptom management. So we don't ever want our patients to die in pain. We want them to go to live their life free of any pain or symptoms, any discomfort, anything that's bothering them, anything that's grieving them while they're still here with us. Yes, death is imminent. Death, I feel, always has a negative connotation around it. People always are scared to talk about it. They're not willing to talk about it. And I don't blame them when they're talking about their mothers passing away, their fathers passing away, their brothers, their sisters, their neighbors, their friends. It's very necessary. And there is a team ready and willing to help your loved one. Common misconceptions, common myths is that morphine will hasten the death of their loved one. We do use opioids to manage pain. We are managing cancer pain, wound pain, these debilitating illnesses that cause so much pain that affect quality of life for our patient. We often hear that, oh, they're going to give them morphine so they can die fast. No, that's not what we're doing. We're managing the pain. Morphine has dual uses, not just pain. It is a very powerful opioid that does suppress the respiratory system, but when used correctly, it's doing what it's supposed to do. It manages pain and shortness of breath. Shortness of breath is very prevalent as a disease progresses, as a patient becomes more and more ill. And when done correctly, it's very effective. If morphine can't be used, different medications are used, different opioids. There's different options. And it's done in a very safe, legal, accurate, correct way. Palliative care and hospice care are the same. Although they both deal and do the same, palliative care is a specialized medical care that focuses on serious illnesses. Patients on palliative are still being followed by a doctor. All patients are followed by a doctor. Patients on palliative care are still being followed by a specialist in whatever their diagnosis is. Cardiologists, neurologists. Hospice care is specialized care that provides physical comfort, emotional, social, and spiritual support for people nearing end of life. So although they have a poor prognosis and are no longer seeking aggressive treatment to treat their illness, we are still there to treat pain and symptoms. Our job consists of, like I said, dealing with all of these vital signs, Foley, catheters, peg tubes, quality of life, anything that will affect their quality of life and make their quality of life better, we're all about. Another thing that I hear is that once patients come on hospice, they lose all their rights. And that's farthest from the truth. Although they are followed by this interdisciplinary team, the patient and their families have the rights to everything. If at any time they don't feel happy with the services they're receiving, they can revoke. They can come off services and go to the emergency room and seek their aggressive treatment. Yes, death is imminent. You are going to see death. There are times that you're going to admit a patient and they're walking and talking and laughing and joking with you, and then a week later, they're passing, and it's going to happen. It's very hard. Sometimes I feel like, or I pray to God that I don't lose my empathy because I see death so often. And I'm so grateful that, God shows me like, no, you're where you're supposed to be because you don't lose your empathy. When a patient dies or nears death, we specialize their care to be there more often. Once a patient dies, once a patient passes, we notify the doctors immediately to call time of death. We call mortuaries of choice to come and have the decedent picked up, but the job doesn't end there. We have a bereavement team who follows up with the families and answers any questions. We dispose of opioids and medications, and we deal with durable medical equipment. Any questions that the families may have, we're still there. I'm very grateful that I love my job. I'm very grateful for this job, and I see myself here. Like I said, I often hear, how can you do that? I can't believe you do that. I couldn't do that. And what I often tell my husband when people ask me and tell me these things is, I'm just so grateful that God gave me this purpose and God gave me the willingness and the heart to do this, because if not me, then who? There are people who have these jobs that are so hard for people, but it's doable for the ones who have the passion for it. I'm super grateful. Like I said, next time you have questions, if you ever get to that point where you would need hospice services for your loved one, for yourself, or anybody, just ask questions. There's a lot of myths, there's a lot of misconceptions, but there's a lot of answers and people ready and willing to answer your questions. So that was my brief presentation on my passion for hospice and what my job entails. And I hope it really helped you guys understand. Thank you.